All right, I'm Dr. Michael Grossman, and today my presentation is going to be about muscle tightness. The reason why I put quotes around that is because there's a big misconception of tightness, and then an even bigger misconception on how you're going to deal with tightness, that people use all different types of modalities to try and treat that. So I'm going to kind of discuss a little bit more in depth about two types of tightness that someone may experience, and then what's the best type of treatment approach for either one of those types of tightness you have. Now, here are the two different types of tightness that everyone will experience. There's neurologic tightness, which is where you have an area of heightened neural drive, or it's neurological in origin. So what that means is, I want you to think of your nervous system as sending a constant impulse to a certain muscle group that you may be struggling with tightness. So it's basically creating this contraction in an autonomic fashion, which is almost holding that muscle really tight. So the way that I kind of differentiate between that one and then this next one here is when I'm moving a patient through a range of motion. So let's specifically talk about the traps, because the two areas that people tell me they're really tight is their hip flexors and their traps. So they're always stretching, foam rolling, all that kind of stuff. Now, if I take someone through a range of motion passively, and I find as I pull their head over, and I usually do it with them laying down, because sitting up, obviously, you have gravity involved, so it can be challenging. I pull their head across, and I'll notice this quick stop. It's very abrupt. Most of the time, that's going to be a neurological tightness type of issue, and I'll show you how we can address that. Mechanical tension is the other thing. So that's tension felt along a muscle group through a normal range of motion. So when I take that same person and I'm pulling their head across passively, I may find one area that feels a little tight or restrictive in that muscle group versus the entire muscle restricting me from allowing the range of motion to occur. So neurologic tightness, and this is going to be a little bit of a breakdown describing a little bit more about it. So it's going to be tightness across the entire muscle group. So for example, the trap is not just one muscle, it's a lot of different muscle fibers, and they kind of attach from shoulder blade up into the base of the head, and then you have a bunch of those fibers on the back of the shoulder blade. So you're going to feel this tension universally across that muscle group when you're trying to work through that area. Now, it's going to be felt both in static and dynamic palpation. So when I'm working on a patient, I'm feeling around on their tissue quality. If I move their head or if it's just sitting in one place, I'm going to feel tightness through that whole muscle group during any type of motion. Now, when it comes to changes in relative tissue motion, there will be a decrease in range of motion. So relative tissue motion just means different muscle groups that kind of slide across each other. So if I try and take you through a range of motion, you're going to have a limitation, which people feel like it's a roadblock, or it just feels like it's so tight they can't go any further when they're trying to move through a specific type of range of motion. This is not going to respond well to soft tissue techniques. So for example, the ART I work on, the functional range release, lacrosse balls, foam rollers, massage tools, general massages, all of those things are not going to fix this problem. You can massage it till the cows come home and you're not going to loosen up that muscle unless you address it in the treatment that I'll describe a little bit later. So save your money if you're going to a massage therapist every single week if you're not getting the results you're looking for, because it's not going to change unless we're taking a more active approach. A big thing that I really want you all to understand is if you have a passive modality input, i.e. massage, lacrosse ball, massage guns, whatever, you're going to get a passive result. The best way to really make changes for your body is putting in active inputs, because active inputs will yield active results. The last one here is a concept called the stretch reflex threshold. So everyone has this, and it's basically a protective mechanism for your body. So when you go through a certain range of motion, I should say, if you don't go through a certain range of motion. So for example, many of us are working at desks. If we don't move our head, whether it's a lateral flexion, rotation, extension, or flexion, if we don't move in any of those type of directions for long periods of time, talking months, maybe even years, and then you go to try to move through a full range of motion, for example, trying to look over your shoulder to back out of the parking lot, sometimes people get an instant pain, or sometimes they'll get a limitation and they actually have to rotate their trunk to try to look over their shoulder. That's part of the stretch reflex saying, hey, we don't know where you're trying to go because you don't normally go here, so we're not going to allow that. So two things that it'll base that on is previous experiences or the muscle's ability to go through that range. So again, if your body is not used to you moving through a certain range of motion and you try to go to that end range, you're going to have some limitation or restrictions because your body just is very good at protecting itself, because we like to do some things that may be a little dumb in nature. So it tries to make sure that we don't do certain things. And if it does, i.e. leads to some type of injury. Now, mechanical tension is the one that you can go to your massage therapist, you can lacrosse ball, you can foam roll, and you're going to get some type of positive response from that. So that's going to be tension felt in a specific area. So if I'm moving patients around and I find, okay, they have tightness here, but not tightness here, I'll know to target that specific part of the muscle. You can only really find a dysfunction in mechanical tension through dynamic movement or dynamic palpation. So as I'm moving patients through ranges of motion, that's where I'm really going to find the difference. If they're at rest and they're not moving through a particular range of motion, generally I'm not going to feel that same type of tightness in that area. And then you will see some changes in how the tissues will be gliding over each other for the different muscle groups. And then the last one referring to all those different modalities for some type of soft tissue technique. Now, how would you treat neurologic tightness? Biggest thing that you're going to do here is something that I had talked about briefly in the previous presentations. That's something called PALS, which stands for Progressive Angular Isometric Loading. So I'm going to kind of walk you through what that really means. I'm going to do it standing just because I can't lay down and it would be a little too difficult to see. So when I take a patient, I'm going to take them through the furthest range of motion that they have in their neck. So let's say I'm bringing their head over to the right side and I feel that tension in their left shoulder. I'll take it as far as I can without them kind of getting that stretch reflex kicking in, and I'm going to hold a good stretch there passively for about 2 minutes, just letting the tissues relax and kind of slowly start to stretch. After that 2-minute period, that's where we're going to implement the PALS. So what they're going to do is, while I push their shoulder down and pull their head over, they're going to try to push their shoulder into my hand and pull their head into my hand. So it's almost going to be like a tug of war where we're going to be competing with each other, except we're going to do it in a controlled manner. So as I'm pushing their shoulder and pulling their head over, we're going to gradually increase that tension. So I'll start at a 20% effort, and I'll say, as I continue to push and pull, I want you to push into my hands in both directions. So we're going to be essentially contracting all of these tissues, and it'll be anywhere from about 15 to 30 seconds, just depending on how the muscles are responding to the movement. So as I take them through that, I'll have them push against me, really holding a good contact, and then we'll have them relax. I'll take them into a deeper stretch, since now we're having the nervous system slowly start to turn down that constant impulse that it's sending from the brain to the body. Do another pass for that exact same amount of time, and I'll usually do about 3 passes total to really get the muscle to settle down and we can start to increase that range of motion. Now, that one time is only going to help it temporarily, so it's something that I usually will try to give to patients as something they should do every day. So in order to really do it to yourself, it can be kind of challenging, so I usually really have to guide people through this. But you basically pull your head over and passively stretch it for about 2 minutes, and you'll actually push your head into your hand, contracting these tissues, slowly relax after about 15 to 30 seconds, taking it a little bit deeper. And during that time, you always want to try to ramp up tension. So you never want to try and hulk it out and go from 0 to 100, because that's how you constrain something. So I always say gradual increases. So think of it as going up the stairs, 10%, 20%, 30%, so you hit your maximum effort of tension. And then once you hit that peak effort for anywhere from 15 to 20 seconds, you're going to start to slowly ramp down. So you're not just going to pull aggressively and then just let it go. Okay, you want to slowly ramp it down to avoid straining any of the soft tissue or even straining the ligaments. Now, here are some key points that could help with implementing PALS contractions through trying to loosen up a tight area. You can increase usable range of motion, so now when you go to back out of that parking spot, you'll actually be able to move through full rotation without having that limitation you may have, if it is in fact neurologic tightness. You'll start to build strength. So isometric is strengthening without movement. A concentric activity, so if we're talking about the bicep, if I do a curl like this, that's what we call concentric contraction. If I have the weight in my hand and I slowly go this way, we call that an eccentric contraction. So we're lengthening muscle under load. And isometric is just going to be if I do an aggressive bicep curl like this, but I'm not actually moving. So it's a form of strength, and it's the safest form of strengthening when it comes to doing some type of muscle contraction, because you don't have a shearing force along the muscle. So when muscle groups go through this range of motion, they're essentially shearing, shortening, contracting. You can have a risk of injury if you're going through some kind of rehab. Isometrics is going to be the safest thing to start building strength for some type of injury. You'll start to improve your control under load. So when you do go to start loading up that tissue with some weight so you can start to build more muscle mass, you'll have more control because you've been working at the neurologic inputs you're giving your body for a specific area you're working. And then you're also going to look at building the progressive load adaptation. So the body adapts to the inputs you give it. As you start to gradually add weight to whatever your strength training program is, you'll start to build the resiliency in those tissues so you have a lower risk of getting injured. Injury prevention entirely is not possible unless you did absolutely nothing, and in some cases that also may lead to injury. So I always tell people, try to progressively move through your workout and don't try and go from 0 to 100. I was talking to Michael before we got started here about how he strained something. Us guys are pretty notorious. If we've been physically active through our youth, took a hiatus from working out for whatever reason, we jump back into it, we tend to think that we're still in our 20s and we can go back to the weight we used to push. So we load up that weight and we haven't done a workout in maybe a few years, go to push that weight and you go, oh crap, this is a lot heavier than I remember. And we often can lead to some type of injury because we overdid it. So to my guys out there, I say try and dial it back if it's been a while and gradually work on progressing your workout. The last thing it's going to do is you're going to start to recruit other neighboring motor units. And what I mean by that is, if you have a really heavy object you're trying to push, and let's say you're upright and you have a refrigerator that just dropped off, you go like this and the refrigerator doesn't move. You get into a brace position to recruit other muscles to try to move that object. The same concept applies here when you're doing a Pal's contraction, as you're trying to pull across and you're aggressively going into trying to reduce that neurologic tension. You're starting to recruit other motor units from your body to really try to focus on getting more motion or strength through that specific area we're targeting. Now for mechanical tension, so this is again where all those soft tissue modalities and techniques will come in handy. So the ART stuff some of you are used to getting, using the lacrosse ball, using the foam roller, or the Theragun, or whatever, all those massage tools that are out on the market. That's when this stuff's going to really come in handy for this type of tension that you may be experiencing. So once we start to loosen an area, if this is in fact the type of tension you have, then my goal is to try to give you some type of mobility stuff so we can improve the resiliency of those tissues and start to get you stronger to reduce or mitigate the likelihood of that tension coming back. So many of us are so focused on getting in that 1 hour workout, calling it a day. And I really try to stress that it shouldn't be looked at as just one workout class and boom, you're done. But start to think of adding maybe 10 minutes before, 10 minutes after for the warm up and the cool down. So that way you can really improve the mobility work, which is the most important part, I think, when it comes to working out. Because mobility is just active range of motion and having control, whereas flexibility is passive range of motion. You do want both, but if we're trying to work on most people, flexibility is not great and mobility is not great. If you really focus on working on mobility type work, you will improve your flexibility as well. And also, flexibility just doesn't yield the results when it comes to long term. So if you're holding a basic stretch for like a minute, that's great, but you go back to trying to do that stretch again 10 minutes later, and it's going to be tight, or it's going to be back to that limited range of motion that you had before. So it's really important to try to implement some type of mobility work in conjunction with whatever workout you're currently doing. If you're not really into wanting to just work out or do weights or anything like that, you can make mobility work your primary form of exercise. And you can do it with just your own body weight or do it with light weights or resistance bands. So I always tell people, if you're not into working out, well, let's try and find something that you do enjoy, even if it's something small, and get you to start doing that. Because when you look at us evolutionarily standing, we had to hunt and gather for everything that we wanted. And I know I've probably beat this point before, but now we're used to just being able to get everything delivered to us. You can sit in this chair, order your food, entertainment, whatever you want can come right to you. You don't have to do anything. What's going to happen if we were to possibly lose those services? How many people here know how to hunt? I know, right? How many people know how to, go through all these ways of how we had to survive all these generations before us? So, it's really important to think about when people are like, oh, I work at Apple, I'm at a desk 80 hours a week, 10 hours a day, chipping away on a computer, and they rarely move in a day. They're coming to me with excruciating headaches and back pain and expect me to change that 1 to 2 visits. I try to really hammer home this point and say, look, things aren't going to change in 1 to 2 visits when you're a professional sitter. You're the best at sitting. You're the LeBron James of sitting because you've been doing it for 80. He trains all the time, and he's not healthy either because he abuses his body so much in being a professional athlete. Besides, it's just a side story, but really thinking about all those sitters or people that have all those kind of issues and trying to realize the best way to try and combat those is just being physically active. So just get up, get your body moving, doing what it was meant to be doing.
It's like the movie WALL-E. Yep, I was just thinking that.
All of them are
Absolutely.
just there and they're like floating around and eating.
Exactly what I was
And
thinking.
they're all overweight.
What movie?
Ryan
Wally.
Wally.
Is that the Pixar one?
Yeah.
Yeah.
Okay, I need to watch this, 'cause
robot?
I
Oh
think somebody
my
has
gosh,
said this movie.
Yeah.
The whole community
That's right.
sitting
We
in like
get
a
it.
floating
Yeah,
chair.
I watched that this
Yeah.
weekend.
And
Wally's
then
a
one break
chiropractor?
loose.
No.
Just kidding.
It's a chiropractic. I'll have to watch that.
Yeah, it's
It's
The
exactly
whole-
what we're talking about.
Okay.
Like what you don't want to do.
Yes, don't be like Wally.
No, Wally's good.
No,
Oh, be like Wally.
Yeah.
Wally's good,
Wow.
but
Wally's
like the
good.
people
Wally's
in
got
the
that the people in the movie.
Okay, I'm gonna use this for the social media post.
We'll ask you next week.
All right. So that wraps up my presentation. Does anyone have any questions on anything?
12 seconds, look at that.
I'm always
Time
good with my
for
time.
questions.
You had shown the stretch for like the neck and how to work with that, but you also mentioned the hip flexors or the second one.
Yeah.
What would you do down there?
So for example, for the hip flexor, I would come, I like doing it on the ground just because it's easier and people don't have to try to balance. So for example, you're in this position, keep that pelvis tucked so you're not arching at the low back. Take yourself to the point where you feel the stretch in your hip flexor. Now it's best to have a cushion for this one because you're going to be digging into the ground and this is not so comfortable. You take your point to the stretch where you can feel it here without extending here. Hold this for about 2 minutes if you can, at least 1 minute minimal. And then you're going to start to make an active stretch out of this. So what I'm going to do is I'm going to take my shin and the top of my foot and I'm going to dig it into the ground as if I were trying to kick a ball like that. So as I'm in this position, I start to contract these tissues, pushing my shin through the ground. Now, we're going to ramp up that tension. So I start at 10%, 20%, and I'm gradually increasing that to that what is my max effort. And this is going to feel like a workout. You want to be shaking, maybe sweating a little bit after doing sets like this. So as I'm really starting to contract these tissues, pushing to the ground, trying to hit that max effort. And then once I hit that, you'll hold there for about 10 seconds and slowly start to relax. Don't just let everything go. And then you'll try and go in the opposite direction. So I'd actually drive my heel towards my butt, which I call this cramp city, or you'll get a pretty bad cramp in your hamstring if you don't do this very often. And you're gonna really try to drive that heel towards your butt, doing the exact same thing you did for the pails. They call that a rails contraction. That wouldn't necessarily be applicable when it comes to injury recovery, but if we're trying to look at improving those ranges of motion, this is something you would do. And then after I do one set in each direction, I'll actually go in a little bit deeper and then do another round of pushing to the ground, bringing my heel to my butt, doing the exact same thing, and then I do one more pass going a little bit deeper and you'll do the same thing. Then after that, I would do some type of strengthening or mobility to start to reinforce the new ranges of motion I gained. Because if you just do what I'm showing you here, and you're like, all right, I'm good for the day, I'm not gonna do this anymore, I'll do it maybe tomorrow, it's not gonna hold what you tried to achieve. So it takes numerous inputs in order to make long-lasting changes to increasing range of motion or reducing the amount of tightness you may have.
So does that mean more than once a day?
I usually recommend, especially when it's in the beginning phase where someone has a lot going on, I usually say at least try to do it 3 times a day, so like a morning, afternoon, evening. And again, you saw what I'm doing here. You want to watch TV? Watch TV shows. You know, you want to, I don't know, eat your food, you have a low table, you can do that too. So when people tell me they don't have the time, I'm like, look, let's talk about your day. What do you do in the day? And they give me their scenario. I'm like, you could have did it here. You could do it here. They go, oh, no, but I can, and I'm like, it's just not a priority for you is how I really see it, because you can squeeze it in. It's just up to you if you want to do it. And you know, we're lazy by nature, and that's just the reality of it. We love to just, I'll just chill, because you know, I had a long day, it was a little hectic, I just want to chill out and watch some TV. And I get it, I mean, I'm guilty of it too, so it's okay if you slip up, right? But trying to get back into doing a good routine is always key. So, you know, don't beat yourself up, or when people give up in February, I'll wait till next January. Why? You know, just do it next week, do it tomorrow. Like, don't look at a calendar to be your determination when life changes. Just make changes, right? So that's kind of how I like to see it. And, you know, people will stick to the excuse, and I never push people because I don't want them to hate me. You know, so I just try and tell them what I think is going to be best for them, because they're coming to me for answers, and I'm trying to give you the solution. So.
But you can do that. You do that every day, or is it like weightlifting where you take a day off and then do it the next day?
Good question. So let's say I were to give you a program today. You do it tomorrow. You're like, man, I'm sore, because you're gonna get sore after doing a series of this stuff. You can either take that day off or go at a much lighter tension. So you could do the same thing, but just maybe only go to 20% effort the entire time, and that's it. You never want to go back to back to back if in fact you do get soreness the following day, just like weight training. You don't just go and do bench again if you're sore from a previous bench press day. But you'll take maybe a day off or do extremely light weight just to kind of help pump out some of the lactic acid and get some movement into those tissues. Because if you do that heavy workout one day and then don't do any type of movement in that general area the next day, well, you're gonna delay the recovery process without that movement. Because movement is really gonna be the biggest key. Yeah.
What really causes cramps, and then how do you prevent it?
Good question. So I find it's two to three things that I see with cramping. One is lack of magnesium. So that's one of the number one things I usually recommend to most of my patients. Magnesium is basically like a miracle mineral because it has a lot of different effects. It can help improve sleep, it can help improve muscle function. So if you do get a lot of tightness or cramping, magnesium is a huge one. I know for myself, I would get cramps in the bottom of my foot or calves. Sometimes I get it so bad it wakes me up in the middle of the night and I'm sore the next day. Since I started implementing magnesium regularly, I noticed an improvement in actually sleep, which has been a huge issue for me most of my life, and then an improvement in just overall muscle function. The second one is dehydration, which I find is actually the biggest one. Most of us are underhydrated. Just key note to remember for hydration, half your body weight in ounces. So if you weigh 100 pounds, you want about 50 ounces of water. I'll let you do the math for you guys. If you're gonna do a heavy day of working out in any ways, try and up those numbers more than half your body weight. And then the third thing is lack of control. So like the one I just showed you here with the hip flexor one, people go in the reverse action and they start getting cramps in their hamstring. It's again, you're exploring an area you normally aren't going into. So your body will go into spasm or cramps because it's like, hey, what the hell are you doing? Cramp up so we can have them stop. I'm dead serious. That's just it's a simplification of course, but it's just your body way of saying, nope, don't do that. The more you practice going into ranges that maybe have elicited cramps, the less cramping you'll get by practicing that regularly. So I got some of my patients, some of more of the higher end athlete types, that when I have them do this stuff, they were cramping up in the beginning. Now they don't really get any types of cramps, and they notice an enormous improvement in their ranges of motion and control. So yeah, those are the three things I would say for cramping.
And I can attest to the magnesium thing because I went to him and I started taking magnesium and it's helped twofold, like a lot.
What kind of magnesium? Citrate, aspartate?
I always play it safe and I say mag-glycinate. It's just the safest, simplest form of magnesium.
What is it?
Glycinate, Glycinate, I think. So there's many different types of form of magnesium. I just keep it simple because some people will tell me, oh, I get like diarrhea if I take it and things like that. Magnesium glycinate usually has the least side effects, if you will.
I've not had any side effects. It's like
Yeah,
taking
I
a
got the
vitamin.
glycinate one.
Yeah.
There is mag citrate. My only concern with mag citrate is a lot of times the calcium is a much higher dosage than the magnesium. And if you have too much calcium, it can actually have a reverse effects where you get kind of like a spastic type of sensations. So I typically would say using magnesium. Yeah, if your doctor had told you you needed calcium because you were deficient, you should take it. Just another side note, when people say you need calcium for strong bones, like in milk, you need vitamin D in order for calcium to be absorbed in the bones. A lot of people don't know that, so you have to take a vitamin D with calcium if in fact you need it. But yeah, that's the one that I generally recommend to my patients.
Well, and he had, I bought the ones he has because he knows that it's a pure form of vitamins, right? It's not, there's not a lot of junk in there because sometimes when you buy stuff over the counter, you don't know what's in there, so I just went through him to get.
Don't get your supplements at Costco.
Yeah.
Don't get vitamins. Just a waste of money.
Well, and what was the other one you talked about? Collagen. You know, that's a big rave right now.
Yeah.
That
Yeah,
really-
and I should do a nutrition
Yeah, you
presentation
should.
at some point
'Cause I started
to
doing
highlight
that
the
too.
things I think that a lot of people are lacking. But collagen is definitely a great one to implement, and I use the collagen protein versus like a whey protein. Blends nicer in my coffee and stuff, and I don't get the chunks.
Hair and nails, ladies. Hair and nails and skin.
Yeah.
Tomorrow.
All right.
All right, thank you guys.